So today is November 25th, 2020. My name is Chelsea Lee. I am here interviewing Shimei Lin for a special COVID interview. Um, yeah, let's get started. In what ways has this coronavirus pandemic impacted your life personally?
Personally, because when we first tuned into the COVID-19 information, a lot of that information come from China, Taiwan, the Asian region, right? And we have family members there, and so we start to pay attention to how that impact their health, of course, number one, to make sure everybody is safe. And then we actually are very concerned about will that impact their lives. Can they still go to school? Okay. And little by little, we realize, oh, different region, other than Wuhan, who actually have gone through the lockdown at the earlier phase, the rest of the Asian countries, they actually pretty much are very vigilant in protecting themselves, paying attention to the health guidelines. So far, personally, I have families in Taiwan. Um, Luckily, their life is still as normal as possible. And even though as young as a 5 year, when they go to kindergarten, they wear masks from day one. And they basically already normalized that mask wearing. So far, other than public transportation, I think most of the regions or cities that we have family members or friends at, fortunately, their life is as normal as possible. But then back here, we're very concerned after, I want to say, around early part of March, when we realized that, it's more than just individual cases. It actually has moved on to the what we call the community spread. When that took place, I was very concerned about how that going to impact our family. Okay, like my husband, he always say, hey, I'm at a high risk because people who's older than 65, they always immediately feel like, oh, we need to stay home. When we go out, we need to wear mask, carry all these sanitizer thing. You get very nervous in a way because when you're in unknown, that's where the fear comes in. So I would say starting March, when we realize that it has moved toward the community, what we call a spread, okay, it impacted us
Mm.
tremendous.
Yeah, for sure. How have you personally coped or dealt with any of the negative impacts from this COVID pandemic?
Um, of course, personally, when we first realized there was actually in Harris County and in Fort Bend County, remember the first positive case came from a few members who went to an Egypt cruise.
Mhm.
Okay. And when they came back, I remember one of the members also is a rice faculty. They went on this Egypt or the river cruise on Nile, right? And just coincidentally, that small group also is my alum group. Okay, so we went to the same high school. They're a few more years senior than I am. I was very concerned because um, one or two of them actually at the time developed very severe symptoms. Okay, so as the ED at the Chinese Clinic Center, I actually was making a great effort to call upon my friends or my professional colleagues at the county health department to see if my alum can get early testing or be put into treatment uh, in a very timely manner because we don't know the outcome of it, right? So I was very anxious at one time and had to call upon different professional colleagues to see if we can help, this small group of my alum members, okay, to get well taken care of in the health area, the healthcare part.
That's crazy. And it was at Rice, especially.
Yeah,
Um, yeah.
and it's yeah.
Sorry.
Earlier phase, when we didn't have the testing kit or the lab, okay, in the Houston area, that
Mm-hmm.
really was a time when everybody was so nervous and anxious because they have to send their lab or their testing kit way to the health department. I think the real what they call the is the CDC. All the testing kit need to go to CDC.
Mm-hmm.
Imagine the waiting time.
Yeah.
Extremely, nervous and anxious. Yeah. So it did impact a lot of us, okay, in different ways. Yeah.
Mhm. For sure. Um, have there been any unexpected benefits from this pandemic for you?
Well, a lot of time, okay, since we're still in the pandemic, okay, sometimes you really need to kind of practice what they call it is reflection, and you need to find yourself some time to really think in and settle down to see what would be the silver lining of this whole thing. Yes, we start to realize, oh, especially with people we know, friends or friends, okay, they are sad news, okay. We know someone who lost their brother in Mexico, and we know someone who had gone through this hospitalization, and then at the same time you start to realize, wow, we actually need to stay together and support each other, not just from the family. Okay, that definitely is the first thing. We want to make sure, hey, we have enough protective gears, right? Like I mentioned, personally, my husband is over 65, so we want to make sure every time he does go out to go to Target, we want to make sure he wear gloves, mask, and everything, and we have enough those uh, hygiene items around the household. But then at the same time, you start to pay attention to the friends or to the relatives that's in this whole pandemic. You call your parents, you call your brothers more often than before. You check on your friends, you check on, like in our culture, the elderlies, right? You check on them regularly because you want to make sure they are fine. And so it seemed like it brought us together closer, and that distance, okay, through this, line or FaceTime or those social media, actually, when we feel like we're all in this together, that distance is, it disappeared. Okay. So I think that's one thing that you can say a pandemic or a crisis that always, brings some reflection or brings some appreciation. You appreciate more, right? Oh, you still are here and you still have what you need. And you start to realize they are vulnerable population. When we are all in this pandemic, certain people really start to have these they could even meet their basic needs, right? So you become more appreciative, right? You start to realize, oh, if I have extra, I need to share. If I can find some PPEs through our network, we want to, get them and then distribute to those communities that are in need of it. So I would say it did help us kind of come together and work as a team.
Yeah, that's amazing. Um, also, so how much of your work do you think has been conducted via digital communication tools such as like Zoom or FaceTime? And how do these compare to in-person experiences?
Well, this is a very good question because I've been thinking about that. We'll do some self-evaluation every now and then because I'm a boomer
Mm,
age,
mm, mm.
okay, generation. So it's quite challenging. I share this with my colleagues. I say, before COVID, okay, we go to work, we kind of work in a setting, office setting, at the community center. And after the shelter in, especially when we are in management, working at the direct service agency, I kind of juggle among the laptop. Right now, I'm on my laptop, right, with the Zoom meeting. And then also my smartphone because people know when everybody is working from home, sheltering, if you really need to reach somebody, you text them. So and not just casual conversation, how are you today? No, a lot of business come through your text message, right?
Mm,
And knowing that even though we are at the center, we did close our front door for walk-ins, but a lot of our key staff members, we still report to work, okay, because we were running, or even now, we're still running the COVID-19 relief effort, meaning we distribute the financial assistance to cover people's rental need, basic needs. So a lot of key staff members, social workers, okay, counselors, we're actually working on site. So I still have my own office, with a computer. But then picture a boomer generation try to navigate through my
mm.
smartphone, my laptop,
Mm, mm.
and my desktop, and my office. Um, it is quite challenging and workload. Basically, we always feel like because the industry we're in, we actually work harder than pre-COVID time. But using all of a sudden we realize, hey, these devices, okay, talk about digital device, not just we're not talking about the hardware part because we do equip ourselves with the devices, but the software, the skill set, okay. Um, Oftentimes I feel like I wish I had taken a class on even a spreadsheet 101, okay, so I can navigate those data quicker. And then honestly, during the COVID, I actually had to go for two doctor's appointments, nothing else but to see my vision because I just have to call my optometrist. Say, do you think I have this issue? I have what they call this, in Chinese, we call 飞蚊症, the flying mosquito. I think they call it it's like the light or the little black dots
Uh,
floater. I think that's what people call it. Okay. I started to see a lot of floating things.
oh.
Black dots. Okay. So they say, oh, that's because you've been reading from the screen too much. So social media and I would say those digital devices under the pandemic crisis, they become so essential, right? But it did pose a challenge, I have to admit, to my generation.
Yeah. Oh, that's crazy. You started seeing the black dots. Oh my
Yeah,
gosh.
yeah, yeah, yeah. I think I learned it. It's called floater, but in Chinese it's more vivid. It called
Mm,
flying mosquito. I
mm.
have to, call my doctor. I say, I don't think it's a mosquito. It's a butterfly. That's how big it was flying around. So, yeah, I got twice checked up. But that is something kind of like we didn't have time to prepare for that. We
Mm,
just
mm,
kind of being challenged, put on the spot, and but it did. If it kind of put us in a learning mode, okay,
mm,
and we just need to learn how to do, like a Zoom meeting or Google Meet. I'm so pleased that at the center, like our language program, language school, after spring break this year, they put all the Chinese school learning virtually, okay? And I was very impressed. I would say principal and teachers, I'm just very impressed that you're able to put a, a curriculum, okay, online within a week or two. That's just amazing.
mm.
So technology become a very essential part but at the same time, we need to be very cognizant that how that going to impact the population that actually didn't have the same baseline. So that's when we pay attention to the real digital divide. Yeah, for school age children and for any, any what we call it is population, even the senior population, right? They couldn't go to the doctors. Can they do what we call virtual doctor's appointment? I tried that, okay, to get my prescription. Oh, I have to navigate the system. And I was very lucky. Their triage nurse was very patient with me. They need to hold my hand so that I can finally get to see my doctor on the screen, right? And so I can picture a lot of those seniors in the 70s, 80s. I can, I believe they will face a lot of challenges. Yeah, challenging navigating the device. Yeah.
Yeah, for sure. So, kind of following up on what you just talked about, I see that. So, you're the CEO for the Chinese Community Center. Can you give a little bit of background on your organization and its response to COVID?
Oh yeah, I love to. Because the Chinese Community Center has been serving the Greater Houston area for 41 years. And previously, we were actively participating in quite a few other crises, such as the Katrina, to the 3 years ago, the Harvey hurricane. So we are a volunteer agency signed up with the Red Cross. If there's a disaster, we can activate our center to become a shelter. However, this time, okay, the center realized, of course, first we heed the county and the governor's order. We did a lockdown, and then we realized that, in April, when the community, especially a lot of the first responders, okay, they're the ones that work so hard, okay, double shift. And, every time you hear an ambulance or a fire engine passing by, you almost want to say a prayer like, oh, hope everybody is okay, because we realize that during this time, I think almost 90% of these calls are to transport patients or emergency call to the hospital because they suspect it can be COVID related illness, right? So it kind of brought this sense of urgency, like what can we do as the community center? At this time, it's not really the first C, the Chinese, it's really the second one, is the community center. What can we do? And we're just very, very blessed because few leaders in the Asian American communities, Dr. Peter Chan, who used to serve at our as our board chair and Southwest Management District board president, Mr. Kenneth Lee, Asian Chamber of Commerce president, Mr. Bing Yu, and a CCA, Chinese American Citizen Alliance executive director, Alice Lee. A few of these community leaders, okay, they come together. They wanted to be of help and also be part of the solution. Why? Because the pandemic, okay, really hit the Asian community hard starting January. When the rumors start to, going around saying, oh, the supermarket had a case. In January, we didn't even have testing. How do you know someone had a positive case? So that rumor really hurt the local business earlier, right? So all the restaurants, they start to shut down. And this small group of community leaders, they actually utilizing their community network and the influence, they actually started a fundraiser. They want to fundraise to deliver 10,000 meals to the frontline heroes, meaning the health practitioners, firefighters, and the police department officers, okay, who are the first responders. So amazingly, within 2 weeks, together, they raised over $100,000. So they did something very creative. They said, let's place order of those meals from the API business owners, okay, restaurants, Korean food, Indian food, Chinese food, Vietnamese food, and then to help them to sustain certain level of business, right? But then at the same time, we also express our appreciation to the first responders. So that project is called Asian American Salute Frontline Heroes. And it was such a successful event under this pandemic, and it kind of activate a lot of volunteers. So toward the end, they are over 20 agencies, API agencies, okay? We all work together. We deliver meals to the senior homes, to the nursing homes, to hospital systems, and we also deliver to even City of Houston, to the waste management department. We all stay home, but the garbage pickup people are still there every day, right? They cannot skip their duties. So we really want to tell the first responders and those people who work diligently, even when the rest of the world is going through sheltering. So that's what the Asian community has been doing, and the center is a key member of this project. And the other part was doing advocacy, because when the pandemic started to impact worldwide, okay, unfortunately, people still think it's a Wuhan virus.
Yeah.
A lot of anti-Chinese, anti-Asian sentiment start to surface, in America, in Texas, in Houston. So we actually fundraise over 100,000, but we allocate a small portion of that to do advocacy activities. We actually, bought advertisement on the Chronicle, Houston Chronicle. And if you get on our website, you will see we still have a segment reporting this project. In this one-page ad, basically we say there's no room for hate. Okay, so we pretty much gather a lot of supports from our fellow agencies, even from other communities, okay, Urban League, the Vietnamese communities. So everybody, endorse our advertisement, and even like the ADL, Anti-Defamation League, right? They pretty much step up and make the message very clear. Under this pandemic, we are working together to be the solution. And absolutely, this is not a time to create, the xenophobia, okay, in any way. So we've been very busy, I would say, but I do think Asian American communities, through our working together, we actually produce a very positive image and energy in the community.
That's really inspiring to hear, especially the advocacy part. That's super important. But I also understand a lot of the Chinese Community Center's programs have been switched to virtual during the pandemic. Have these programs been well received? And also, do you think there would be a value in continuing to offer some of these programs via digital tools even after the pandemic?
I think this is a question we've been thinking, kind of discussing about in our business planning, such as the language school, right? The Chinese language school. We have a pretty good enrollment, sizable enrollment for adult Chinese. And these young professionals or college students, they actually enjoy virtual learning. And so to them, they actually upkeep their study and their attendance are better, and somehow their communication with their instructors are even closer because you can always utilize, a messenger or something to pose question. So we see the benefit of virtual learning. However, we do have a different population, which is what we call the new immigrants, and we do serve a population who's looking for jobs and or between jobs. That population and some at-risk youth population, then you will need to be more intentional creating a what you call it is user-friendly learning environment, because you cannot assume everybody, oh, when you go online, everybody have the same baseline. No, we cannot assume that. So we gather all the laptops from a Chinese school because we don't have in-person class, right? So we have about 30 iPads there. They were donated by our PTO. It's most like PTA, okay? They bought this iPad for our language school, but then during the shelter in the lockdown, we let those students in the adult education or in the after school youth, which is a risk population, more or less what we call it is the low moderate income families. We let them pretty much like borrow it, okay, because we want to make sure they have the adequate device. So the device will impact the learning outcome. So in one way, we're looking to the benefit of virtual learning, but I would say if that population is already equipped with the hardware and the software, meaning the skill set, then that actually is even scaling up quicker. But then if you're looking into it, that population that really come to CCC to gain their skill set, then when they study at home, we want to make sure they have the adequate device. Yeah. And I think even the public school system right now is still working on this challenge. Yeah.
Yeah, for sure. I also heard that you initiated some of the senior care efforts during the pandemic. Could you talk about some of these contributions?
Um, as we all know, during the the shelter in, we do have a very robust senior center, and we have a wellness program. But knowing that the senior is at high risk, okay, so a lot of them, especially Asian families, they are very hyper vigilant. Like their grown children will say, "Oh, please, mom and dad, do not leave your home." Okay, they just didn't want to risk, okay, being exposed, right? Or they try to avoid unnecessary exposure. So many of them stay home. Hey, 3 months becomes 6 months, and now it's still ongoing, right? Way into the ninth month. So we actually um, start to ask our social workers or our professional staff members in our senior department to actually schedule some outreach activities. They will go to the senior housing, even though it's a small group. They will kind of, checking on them, okay, to make sure they are okay. And we did find out that many of them express they feel depressed because of the social isolation. And we also, during these sheltering, especially during the summertime, we every now and then we will do drive-through this like a distribution of the masks, okay. And we also just recently last month we did a drive-through flu shot. We were actually thought, oh, we're not sure how many people will participate, right? Surprisingly, they were over 130 families, okay, where they drove by to get the flu shot, and many of them are seniors, right? So we initiate quite a few activities in addition to our online program. We did move our like Tai Chi class ukulele class, okay, all these senior activities online. Like it's a small Zoom group, okay? 12 to 15 of them can get online and still do activities with their instructors. But at the same time, we are very mindful that they will still be quite a lot of them did it because, like I said, it can be digital challenges or just because they feel depressed. They just lose interest of participating. So we have to take a look at both. You know, for the virtual program, we keep it going, and then we continue design some outreach activities so that we will go to them if they couldn't come to us, right? And then we also bring mental health into our service plan for 2021 because we know for sure because the social isolation, okay, senior will have a lot of symptoms, okay, that's associated with depression. And for the adult population, it will too, right? Economic loss, right? Many people, they either got laid off, okay, or small business owner, they have to close their business. And people who rent apartments, they're gonna get evicted. We will see what we'll call it is increasing cases of mental health issues for sure in the coming months.
Wow, that's also a very vulnerable population to loneliness. So that's very important that you are doing this. Yeah.
Yes,
Um,
yeah. We took the opportunity of the Moon Festival. This year was a late one. It was in October, early October. So because a lot of time, if you call them, you say, "Hey, Mrs. So and so, can I come and visit with you?" They say, "Oh, you don't need to because it's COVID time." But then if we call them and say, "Oh, it's Moon Festival, we want to just bring some moon cakes and visit with you," they say, "Oh, okay, you're very welcome." So we really have to, you know, kind of designed it so that they will not say no to you. And then they just, I remember our social worker bought some pineapple cakes, okay, and the moon cakes, and they visit with them, and that's how when we find out. Actually, they were very honest with our staff. They tell them, yeah, either themselves or they know someone in the same housing complex that actually are having depressive mood. Yeah, yeah. That's why a lot of time when we realize they couldn't come to us, our only way is we go to them. And of course, we follow a lot of the precautions and everything. We're hoping that if we can, put together a very well-rounded service design, we hope we will be able to offer help to the vulnerable population who actually are isolated, but at the same time keep up the health and independence of those who are able to um, continue with their engagement with the center's activities.
mm, sure. Yeah, I also heard that prior to the pandemic, CCC had completed a new senior activity center. Um, and so, will this center be focusing on serving senior members specifically in the Chinese community, or will it be open to all seniors after the pandemic?
It is actually a community senior center, meaning it's for everybody. Okay. We actually welcome the community to book the facility for different activities. Remember, this year is quite eventful. We actually gone through the 2020 census, right? And then we also just finished the 2020 presidential election. So even though we locked down technically, the new center, the TT Child Family Center, is just still, offer a lot of opportunities to the community. When we did the census 2020, we host like a panel discussion through live streaming, and we did it in our tea house. our new center, a two-story building. Okay, it is a two-story building. The first floor is dedicated or kind of licensed to what we call a DAS, Day Activity and Health Services Center. Of course, at this time we don't have DAS members coming in, and but then we utilize the space. Remember, we actually have a small learning part for full day care for the at-risk youth. When the school locked down, the parents, some essential workers still needed to go back to work, right? So they would send their children to CCC. When we wanted to practice social distancing, we let them use our new senior center's dining hall. It's a beautiful, big area, activity room for them to, set up their computers and they can continue log on to their school learning. So what we call it is repurposing our space. Okay, so the new senior center actually truly helped us out during the pandemic because we're able to move the children to the senior center. And on the second floor is what we call community space. We have an auditorium, a tea house, and activity room. And so when we did I believe it's Census 2020, we will have a webinar or we will invite a speaker, right? We do live streaming, but then at the same time, we will also have some give backs. If anybody who want to respond to the Census 2020 by coming in, utilize our laptop because it's online, okay? There is a majority of the respondents have to go through online. So if they walk in, we would utilize the very, very rooming facility to offer them the direct services and also give them some gift back for, like self-care kits. So our senior center actually, we're so blessed that the center actually have been there and ready for the public. And we actually utilize this space every now and then in the past 6-8 months. Yes, yeah. But we plan to bring back or start up the DAS program because knowing that certain senior members they express a need to kind of come to a what we call it a supervised environment where we can provide them with good health care and nutrition because we have a commercial kitchen that prepare the breakfast, lunch, and afternoon snack. If a small group of senior they express the need, we would like to bring them back to the facility. Yeah.
I guess we're gonna talk about some more general topics, but how have you seen the Chinese community or Asian community in general been impacted or targeted by this pandemic?
Okay, of course, we talk about how the anti-Chinese sentiment impact the community. It does. It get too close. Okay, like we have parents, they worry about sending their children back to school. They're afraid of being bullied, right, by their friends, or maybe their children have some best friends. They are non-Chinese, and then they are so afraid when they resume class their friend would not even come closer to them or talk to them because maybe their parents said, "Oh, you need to be careful because your best friend is Chinese." We cannot second guess people's intent, but we know it will happen. Okay, so a lot of that, the fear that generate the anti-Asian sentiment, that is that impact the Chinese community in general across the board, right? And then you worry about a lot of profiling. So I would say this, this pandemic, COVID-19, the impact to the Chinese population or Chinese Americans are more in the cycle, what we call it is as in the emotional, the what we call it is emotional, mental health, and a lot of that is um, xenophobia. I hate to say that, but it will be, okay? But we actually are also having the proactive opportunity to eliminate that opportunity for people to act in that manner. Meaning, how we turn the negative situation into positive. It has to be an intentional effort, okay? Because by doing the meal project, by doing all these advocacy effort, we do see how the general public start to change their image about the Asian American community. Chronicle had done quite a few full page coverage on how the Asian American organizations come together, fundraising for PPEs. They purchased $1 million worth of masks, gloves, and the protection gears for the health practitioners. If we organize ourselves and take a proactive attitude, I believe the impact, the negative impact, will be minimized. Okay, so it will. Unfortunately, we've seen that. Okay, locally in Texas and even nationally, you've seen the impact. Yeah, and I'm hoping that the political landscape will be a little bit more friendly, and then we can actually address the more pretty much like our equal rights, okay? Because it has to be an effort. It will not happen by itself, okay? This is something that actually will give all the Asian American organizations some homework to do. Yeah.
Yeah, for sure. Talking about like the Asian American communities, do you think this pandemic has brought all Asian American community members closer together, disregarding the ethnic background?
I do think so because remember, for Asian countries, okay, we don't have a uniform language, right? So, non-Asian couldn't tell whether you're Chinese, Vietnamese, or Korean, right? They think you're all the same, and because of that, we're being challenged at the same time. Remember that incident in Midland? That actually was a family from South Asia. I think it is from Laotian. I think they are, or no, I think they are either further. Where did they come from? It's remember the family in Netherlands. They got attacked in Walmart, right? Um, so they are not Chinese, but people just think they are Chinese, okay, or they all look the same. So when they emotionally, couldn't handle the stress, they become physically violent, right? So the family, even their children got hurt. We immediately realized we need to come together, regardless if you are Chinese descent or not, right? So when we work on the advocacy part, the Korean community, they supported us. The Vietnamese community, they supported us because we know when it's at this scale of crisis, if we don't work together, we don't utilize our resource together, we're all gonna be, going down together. So, we can only support each other, share our resources, and speak up for each another, take care of each another. That's how we can, make the turn, okay, make the turnaround. So, yes, I do think the pandemic has brought us together.
Do you think that there still needs to be efforts to enhance relationships among various Asian ethnic groups?
That's something it's ongoing. Actually, in Houston in particular, we have a collaborative called ECI, Empower Community Initiative. We have about 10 to 15 members, and our goal is to promote Asian Americans' voice through civic education and civic engagement. Okay, so it has been ongoing for many, many years, and the pandemic only strengthened the, the unity of this organization. So like I said, it will be an ongoing homework for us. Take a look at this election, okay? Asian voters, the voting rate has increased, okay? And then people say, well, that's because, we realize this is an important election. It should always be important when it comes to voting, right? Because that's our entitlement right. If you are a citizen and you become a registered voter, you need your voice be heard. You need to have a seat at the table. How are you going to get there? By voting, by being counted, right? So it has been an ongoing effort, but more so this year and more so going forward, because we truly understand and experience, okay, the challenges for not doing it, right? And so I really hope that going forward, all the AAPI organizations and communities, we will continue our partnership, will strengthening our collaborative and own, because that's the only way we will make the AAPI part of the, the big, fabric of this United States, right? And only by having our voice heard, okay, that we can say, yes, we are American too, right?
Yeah, for sure. So we did talk a little bit about like structural inequality, but what do you think the pandemic has revealed about these structural inequalities in our society?
If you take a look of the Asian culture, the characteristics of Asian culture, we actually have gone through, okay, a lot of um, inequality from the Chinese exclusion clause, from the when during the 1940s, the Japanese Americans, right? They've been put into the camp. All these inequalities, we seldom make a big noise of it.
Mm,
Um, we realize that it existed, and then if you don't address it, you don't correct it, okay, it will not disappear. So the pandemic actually taught us a lesson. The inequality, okay, a lot of time, if you study the 1960s Equal Rights Act, okay, the human rights movement, okay, we actually APIs, sometimes we write with the Black, Black American or African American movement, social movements. However, we cannot always just write with them, right? We also need to form our own voice, our own movement to address the inequalities, okay? And I truly think with this pandemic being called Wuhan virus for a while, that actually need to, okay, wake us up, okay? It wake us up and say, hey, we need to be responsible for this, and we need to address this. And so I do think by participating, more in the public service, having more people running for offices, and also more people, Asian Americans, especially Chinese Americans, engaging in the human services. Yes, we have a lot of scientists, we have a lot of Top notch engineers or astronauts, okay? But we also need to, invest in the human services, right? Public services. And that's how we can have more control to address the inequality. Because our culture is very different than the Western culture. You don't see us going to the street and do a protest, right? You seldom see Asian people, do that. So then, how are you gonna address the inequality? First, you have to acknowledge there's an issue about it. There is an issue about it, right? Okay, and we have to knock down the model minority image. Okay, and then we will engage in the civic activities, right? Engage in voting, engage in running for offices. And these are the things Asian American needed to do in order to, address the inequality. And I don't think there's any other shortcuts. Um, yeah.
Yeah, you brought up a lot of really good points. Um, yeah, I I think you also kind of started addressing my last question, but maybe you have some other things to add on. So, how do you think we could come out of this pandemic stronger as a community?
How I think it has to be a collective effort. And when we say collective, not just API ourselves, we also want to invite our non-API friends, okay, and communities. This is very important because when we say it's a pandemic, it, it's a global crisis, right? So API has been, we've been, taking this a hard lesson. So we come together real quick. Okay, we realize that we really need to work this out together, be part of the solution. But at the same time, because it's a pandemic, only by joining forces with our non-Asian allies, okay, the African American communities, the Latino communities, and even the what we call mainstream communities, we all need to work together. That's how we strengthen us. Because remember, we talked about the model minorities. You don't want to be an assumption. No, we can never be an assumption. Oh, they will be okay. Well, they will take care of themselves. No, we cannot have that kind of mentality anymore. We fight for our equality, we fight for our rights, but at the same time, we want to be part of it. The equality meaning we all are the same, right? So don't forget, that means the the Anglo-white, the African American, the Latino, and the API. Only by doing that, okay, we will make ourselves stronger. We want to be a stronger partner, right? This, like I said, this holistic uh, nation, right?
Do you have anything else that you would like to talk about or ask me or anything? Um,
I actually do want to comment on your study because recently I have participated in a few symposiums and interviews with the university students. I'm very, very impressed and very appreciate that the Rice University study or the Asian study programs, you actually took a very deep angle to see how the COVID pandemic impact the community, the Asian American community. It is important because a lot of time we call ourselves social workers, practitioners, we work on the field, right? University students, your professors, you are the intellectuals, okay? It's very important. We'll need to touch base with each another to first identify the issue, and then we work together to address the problem and come up with a solution. So I really want to thank you and your your department and for arranging this interview and take interest in this challenge.
Of course, I want to thank you for your time and, giving me your perspective. It was very interesting, and I'm gonna have a blast editing it and all that. So,
Okay, yes,
yeah.
please do. Yeah, well, thank you very much. And in the future, if there's any, similar topics or when things come down, I welcome you all to visit our center.
Oh, thank you. Yeah. Well, take care.